how the imaging modalities have changed over the years, I would say when I was trainee 20 years ago, the only thing that we had as a cardiologist was echocardiography. And we had the VHD tapes where we were recording the images and we had to review it, and it lengthened very much the process of evaluating a patient until you get the report. Right now that has changed completely because most of the labs are digitalized. So you record the images, you go later on to your room, you check the images, and you do the report much faster. And particularly now, there are systems that even tell you, look, here you have the measurements of the ejection fraction, the measurements of the aortic valve gradient, everything so that you can do the report much faster. And those images that are digitalized in the echo, they are also digitalized either on PACS or in other systems that can go to your outpatient clinic where you are having the visit with the patient, and the patient can see with you how the heart looks like. And that helps a lot. In terms of other advances that we have witnessed, I think that together with the transcatheter interventions, we have seen how the different imaging modalities can be complementary to each other. It's not anymore only echocardiogram. There is also computed tomography that gives you information on the structure and the function of the heart. And from that, you can get a lot of information on how the patient may develop in the future. And we have cardiac magnetic resonance where it gives us information on the tissue characteristics that before we were not seeing at all. And we have learned from those how we can stratify the risk of the patient of having later on heart failure, arrhythmias, or any other complications. And that has changed completely the view of the cardiologist. It's not anymore only echo, it's the integration of all the imaging modalities with the patient in the center to answer a clinical question, not just because of the beauty of the images, is to practically answer the question of that patient and how we can improve the outcome. I think that for me, imaging is the center core of the evaluation of patients with cardiac disease. We have been educated, and I include myself on that, as a person that relies very much on imaging. Seeing, you know what you are going to do. Before, many years ago, people were listening. And I think that that's important, and we should not lose it, because listening, not only the heart, listening the patient, that's the basis on how you are going to approach the patient. That's the most important thing. Listening the heart with the stethoscope is a little bit more difficult and needs a specific art. And not everybody is as good as it was in the past. And I think that seeing what you are going to see gives much better view and much better knowledge of what is the cardiac condition of that patient. So for me, imaging is central.